Good morning, good evening, good night, all of you. Just I was going online on Facebook, and I think now we are online. Just let me check. Today we will discuss reading tips, and tomorrow we can discuss what you want. Okay. Okay, so just 1 minute, let me share in groups and then we can start. Okay, so I can see Facebook comments also, so if anyone wants to comment on Facebook. Okay, just let me open the material. We will discuss today reading part A and B. In the future, we may discuss part C also. Okay, let me share complete screen with you. Okay, can you see my screen? Can you see something in Word file on my screen?
Yes, sir. No.
What you can see?
My project taxi.
Yes, yeah. Okay, so let me just adjust things here. So can you write in the comments on Facebook or in the Zoom who are with me on Zoom? Are you a doctor or a nurse? Just quickly, so that we can focus accordingly. If there are more nurses, we will focus according to nurses. So
I am nurse.
just write in the chat, please. Yeah, thank you.
Okay.
Just quickly, please. So nurse, 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 doctor, nurse, nurse. So there are more nurses. You can comment on Facebook also. So there are more nurses than doctors. So we will be focusing more on nurses. But as you know, reading is same for doctors and nurses also. Okay, for both of you, reading module is the same. Okay, Amna is a doctor. Okay, thank you. So we will start with reading part A. So we will do some questions from reading part B also, if possible. So can anyone just give me quickly how we do reading part A, how we attempt, what are the tips for reading part A? Just quickly, please. Anyone?
Yes, sir. So, sir, first of all, we will do skimming and then scanning. Then we will start from question 1 to 20.
Okay.
And we also differentiate between the text. What about text A and text D, text C, text D, like that?
Okay. Okay. So that is good. That's good. So yeah, that is true. So for example, if you see this in the real exam, just let me tell you the importance of reading part A. The importance of reading part A is if you get 20 out of 20 in reading part A, 20 out of 20, then your chances of getting B in the real exam are almost 90% plus. Okay. 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 So your chances of passing increase with reading part A. Reading part B and C are difficult. Most of you will get 50% correct, 60, 70% correct. But in reading part A, you can get 20 out of 20 correct. It is possible because this part is easy, and the game is the time management. In reading part A, the main game is time management. So if you manage your time, if you are able to do all the 20 questions in 15 minutes, so then you can pass your reading part. Otherwise, it is a bit difficult, and many of you keep taking the exam again and again, just in the hope that one day there will be something good. Okay, but you have to prepare well. Okay. So when you see this text, omeprazole, what comes in your mind? Anyone can tell me what comes in your mind when you see the text A, omeprazole. What comes in your mind? Dr. Ramana, can you hear me? Or Miss Rabia?
Omeprazole we are giving when some like burning. Sometimes patient has nausea, vomiting.
No. What comes in your mind for reading part A? So omeprazole is not a disease, is a
Yeah, it's a
medication.
medicine.
Okay.
Yeah.
So it is a medicine. So what comes in your mind? There is PPI, antacid. So there would be question about medication. Okay. There would be no diagnosis, no like as we have malaria, as we have other diseases. So this is medication. Okay. So then we will do quick skimming and scanning. Okay. So what you will do in skimming and scanning, that is very, very important. The skimming and scanning are very important parts. So what you will do in skimming and scanning?
We highlight the words,
What you will highlight?
the bold letters, numbers.
Yes, you can highlight. Yes, we can highlight. That is true. What else? What else we can do?
We can underline some hedging words from those passages.
Yes, you can see the main words, okay? Headings, subheadings, and you can read the first sentence of each paragraph within the subheading, okay? So you need to get overall an idea about what this text is about, okay? Can anyone scan this first reading part A, passage A? Means text A. Just quickly.
Yes, sir.
Yes, please.
Acid is produced naturally in your stomach to help you digest food and to kill bacteria. Acid to damage stomach, causing
No, you don't need to read.
inflammation. Acid
You
to...
don't need to read complete, okay? You don't need to read
Yes,
complete,
sir.
okay? Just give me idea what this is about, okay? So
Yeah.
just to save your time, I will tell you, okay? So here, antacid is produced naturally. So they are talking about something about the stomach, about physiology, okay? Physiology of stomach or the acid that is produced, okay? Yes or not? So I don't need to read the complete sentence. The acid is irritant, so means they're talking about
Yes, sir.
acid. Okay. Other people can have problem with muscular bands, so they're talking about muscular problems. Okay. PPI such as meprazole stop cell, okay, from producing too much ester. So this is how the meprazole works. So then
Yes,
in the
sir.
last paragraph, this is available on prescription. Means this is they're talking about how it is available, how it is not available. Okay. Miss Nirmala, Miss Noreen, anyone can participate? Anyone else wants to participate? So now you have algorithm for diagnosis and treatment of refractory GERD. Okay, GERD is just reflex disease. So you have algorithm. Okay, let me make it small for you. So this is long table algorithm. So what you need to know quickly, how you will skim and scan this quickly. Anyone wants to participate apart from Mr. or Dr. Farooq? Anyone else? Anyone else wants to participate? Dr. Zakia? Anyone else?
Yes, sir.
Okay, Ms. Rave. Okay. So what you will see quickly in this algorithm, what you will see?
Symptoms. Then
Symptoms, okay?
And we
yeah.
need to
Then
highlight the same letter and
So
review
you have to
again.
see quickly. Yeah, you need to see quickly what are the important things in this algorithm, okay?
okay, sir.
So PPI once daily, what will do? Therefore, if there are alarm symptoms, you need to do this test. If there is failure, you need to do this. If there is, this test, PPI twice daily, you have to take. If there is failure, what you need to do. If there is no success, what you need to do. Empirical therapy here. Here is main modulators. You don't need to go into the main modulator pain review again. This is other type of treatment. Here is at bad time anti-reflux surgery. Uh, here is main modulators. Okay, so you need to quickly see what includes in this text. Okay, so then you have text C. So what you can see in the heading in text C, please mute those people who have background noise. Please mute.
Precautions.
Yes, please. Yes, cautions. So there's a lot of background noise. Please move to a quiet place. Okay. So here they are talking about cautions. Cautions mean what you need to take care
Precautionary
of.
measures.
Yes, cautionary measures when you take omeprazole. Okay, what you need to do. Okay, so you don't need to just read this. You have to read the just quickly. I can also see people on Facebook, so you can comment. I can see your comments. Okay, those who are on Facebook with us. Yeah, Zebunisa Sayyida Zebunisa is there, so I can see your comments. So you people can comment on Facebook. So here, after reading the main heading, that is cautions. So what you need to do? You can see there are bullet points 1, 2, 3, 4, 5, 6, 7, 8, 9. There are 9 bullet points. What you need to do? Just quickly underline the main things, okay? The main thing.
Scam of this
Yeah.
paragraph.
Yeah. So quickly underline the main things. In first bullet point, so PPI possibly associated with this incidence Clostridium, diarrhea. So they are talking about relation of omeprazole with diarrhea, okay? So you don't need to go into detail. Omeprazole relation with diarrhea, okay? This specific diarrhea, okay? May require dosage reduction with liver. So relation with liver disease, okay? Caution in liver disease, caution in diarrhea, okay? What you need to take care of in diarrhea, what you need to take care of in liver disease, okay? Here is a cutaneous lupus erythematosus disease, okay? So lupus disease, what you need to take care of in lupus disease, okay? You don't go into detail, okay? So here Relation with what? Relation with what? Can anybody talk, please, quickly? Because we need something. Yes, we need something, interactive so that all of you can learn. Okay. Okay. So here is relation with gastric tumor. Okay. Gastric tumor. Okay. In the next bullet point, magnesium deficiency. Okay. Relation with magnesium deficiency. Okay. With magnesium. And next they are talking about what? What is your main point in next bullet point?
Formation of active metabolites.
No. No.
Decrease
Your relation with clopidogrel.
Yeah.
With this medication, clopidogrel. Okay. And next bullet point was relation with what? Acute intestinal nephritis. Okay, you can underline all of these main things. Okay, diarrhea, liver disease, just quickly because you have only 15 minutes. Okay, just quickly. Here is gastric malignancy. Here is just quickly, if you see, serum concentration, methotrexate is there, methotrexate. Okay, so these things. Okay, methotrexate, administration of these things. Okay, now in text D, you have two subheadings. Okay, text D has two parts. Text D, by the way, people on Facebook, you can comment because I can see your comments. Okay, so if you go, okay, these are my own samples. You will not see these samples anywhere. When the material that you have in PDF or Google Drives or anywhere else, you will not have these samples because these are my own samples. I made these almost 2 years ago because, as you know, I'm teaching OET almost for more than 3 to 4 years. Okay, so some people, they pass OET exam, then they start teaching. Okay, this is not fair because you need to be very competent when you're teaching someone else. You can pass yourself, but this does not mean that you are good at teaching also. So just be careful whenever you subscribe to anyone. Just be careful. You should be competent teacher. I'm not asking that you should come to me because even in the last 5-6 months, I was not taking students. Even I was not taking free classes. So just I had no free time. So I started the classes now. So now in the reading part D, you have two subheadings. Okay. Can anybody tell me what are the subheadings in reading part D in text D? Just quickly, please.
Long-term use and effects on pregnancy and breastfeeding.
Okay, so in text D, you have two parts. In one part, there would be something related to long-term use of PPI. In the second part, there would be relation of PPI or omeprazole with pregnancy and breastfeeding. Even you can skip reading this in detail, but just if you go quickly, long-term. So here is polyps, okay, benign polyps. Okay, they are talking about the relation
Gastric
with
cancer.
when you use PPI for a long time, so there is problem with polyps. Okay, so it can lead to polyps. Okay, so they are not cancer and this and that, not associated with this and that. So this is possible associated with long-term use, dementia. So here is relation with polyps. Here is a relation with dementia. Here is there is one study here. Calcium absorption. Okay, calcium absorption
Magnesium.
quickly. Okay, there is with risk of infection such as C difficile. Okay, so many infections, pneumonia, Clostridium difficile infection. Okay, there is some hypothesis also. Okay, decrease antacid stomach acid production. Now quickly with pregnancy and breastfeeding, the safety of use. Okay, so you can use in breastfeeding. Epidemiology show this and that. So there are birth defects. No clinical trials have been evaluated. So then you have two subheadings here, two sub bullet points. So you need to see here the pharmacokinetics of omeprazole molecule strongly suggests the safety of omeprazole during breastfeeding. Okay, so this is they're talking about in detail about the safety during pregnancy, about pharmacokinetics. Okay, omeprazole is a high plasma protein bonding, 95%. So little amount is transferred to in the milk. Okay, and then we need to be administered with enteric coating formulation. So they are talking about enteric. This is normal dose, safe during breastfeeding. So this is overall statement. Okay, so now my question is, people on Facebook, I can see your comments. You can ask anything. You can ask me anything, and you can comment. If you have any question, you can comment. And if you want to join me on Zoom next time, you can text me on my WhatsApp number. So I will send you the link for the Zoom class. Okay. No, someone should come. Okay, should talk with me. Anyone who has not participated already, please. Dr. Ramana, Dr. Yasin, Roha, Sultana. Anyone else wants to participate? No?
What do you want?
HPC. Yeah,
What do
okay.
you want to
Let
ask?
us, yeah, let us discuss. Let us do the discussion. Okay. So you
Okay.
know you have done skimming and scanning. Okay.
Yes.
After skimming, in how much time you should do skimming and scanning in reading part A?
2 minutes, sir.
1 to 2 minutes would be enough for us.
1 to 2 minutes would be enough. Okay. 1 to 2 minutes would be enough. Okay.
Yeah.
Just I'm repeating. These are my own samples. You will not see these samples anywhere else. And one other thing is, the author who have written these samples is teaching you. So when we make some samples, or when we make a paper, or exam questions, the person who makes them, they know better. Okay, what are the tricks? So how they have designed the thing. So it is better way to learn here with me. Okay. So now, after skimming and scanning, that you will do in 1 to 2 minutes. Okay, maximum 1 to 2 minutes. Okay. The reason why we do skimming and scanning? Why? Can anybody tell me the reason, the importance?
To get a general idea about the vortex, sir.
Very good. Okay, so to get a general idea about the four texts. Okay, for example, if I see this question, a study related to use PPI. If you have not done any skimming and scanning, you don't know what is included in text A, B, C, D. I am not asking you to read it complete. Okay, just quickly. So how you can find it if you don't know? Then you will go to text A, you will read there, then you will go to text B, and then you will go to text C, then you will go to text D. So you will waste lot of time. Okay. Imagine if I give you 1 hour, all of you can get 20 out of 20 reading part A, because reading part A is not difficult. The only game here is time management. Okay. So in reading part A, the only game is time management. If I give you 1 hour, almost all of you can get 18, 19, 20 correct answers. But in the real exam, you will get 10, 12, 14, 15. And then if you lose marks in reading part A, then you cannot expect to get B in the reading exam. Okay, because this is very important. This is easy is important. Okay. So now you have a general idea. There are two things how people attempt reading part A, means the answers, the questions. Some people skip 1 to 7 question or 1 to 6 questions. They come to this part, okay, where you have to fill in the blanks. Okay. In the reading part A, you have to give in which text you can find this answer. This is a little bit overall. Okay. This is not something exact. Little bit overall idea in which text you can find this. So in next parts, if you go 18 to 14, this is just fill in the blank. Okay. In the next, it is also like fill in the blank. You have to find the exact answer. So some people, they skip the first part, 1 to 7 question. They start with question number 8 or 7. At the end, they come back to question number 1 to 7. Anybody can tell me what is the reason behind that?
To save the time, sir. To save our timing,
Yes,
because
please.
to save our timing,
Yes, you can
because
say.
1 to 7 are easier question as compared to 8 onwards. So because we need
Yeah,
to only write the alphabet, I mean A, B, C, or D. That's it. We
yeah.
go for
Because when you do question number 8 to 20, there are almost 12 to 13 questions. When you're doing these questions, you are getting idea in which text includes what, okay, overall. Okay, so means you are reading in a little bit detail where you can find question number 8, where you can find question number 9, where you can find question number 10. You are getting a little bit, you're reading in detail, a little bit in detail. So when you come back to question number 1 to 7, you can get the answer easily. Okay, this is one strategy, but it depends which strategy works for you. Okay, some people, they start with question number 1 to 7, because these are easy questions, they see what includes in which paragraph, and then they write these answers, and then they go to question number 8. Okay, so you need to see what
So what use DrChe to
suits you
do?
better. Okay, so what suits you better, you can try one sample with this way, you can try some samples with this way, some samples with other way. So then go to one way. Okay, because in the real exam you cannot try something, you need to try in when you are preparing for the exam. Okay, so just see what suits you better. Okay, just to repeat. Okay, people on Facebook, I can see your comments. There is Nasir Khan, Muhammad Abdullah, Dr. Amna Abdullah, Dr. Tahira Zahoor. So I can see your comments. Okay, so you can comment. I am also in touch with you also. Okay, so there are two ways. Skimming and scanning at the start is a must, is like something obligatory. Okay, yes or no? Quick skimming and scanning in 1 to 2 minutes. So you can say average 1.5 minutes. Okay, 1 to 2 minutes. This is obligatory. Okay, then you have two options. Can anybody tell me what are the options? What are the options? How you will attempt the questions? Where you will start? What are the options? Please unmute and talk with me, please.
You can start from first question, or maybe you can start with the question number 8 to further on.
Yeah, okay. There are two ways. You can start from question number 1 to 3, and you go to question number 20. Okay, just in order. Okay, this is one way. Other way is, some people, they find it very easy if they start with question number 7 or 8. Okay, because in first 7 question, this just in which text you can find this answer. You just need to answer text A, B, C, or D. Okay, you don't need to give the exact fill in the blank. Okay, so these are two ways. Okay, so now let us try just in order. Okay, just in order from 1 to 20. Okay, so now you will just tell me who will participate. The first question, who will answer first question? Who will? So Dr. Pyal. Okay, so how should I call you?
Huh?
What is? Yeah, doctor, can you hear me? Okay, so Dr. Pyal, can you hear me? No, I can't hear you. Can you hear me? Okay, anyone else wants to participate? So you will answer me. We will do the question number 1 together. Anyone? Miss Bushra Yunus? Miss Nirmala? Or Dr. Nirmala? Okay, yeah. You will answer question number 1, but you will tell me how you will answer. Okay. So question number 1 is, what is the key point? Okay. What is the key point? What are the keywords in the question number 1?
Role and what defects.
Yeah, in question number 1, what are the key points? What are the key words?
Birth defect, sir. Birth defect.
Birth defects. Okay, birth defects. Do you think you can find the same word birth defects in the text?
No,
Do you
sir.
think
Maybe
this
only
is
synonym of birth defects.
just believe me, I have not prepared this class, means today I have one free class, so I will go, I will sit for 1 hour, I will start preparation, and then I will teach you. No, these samples I have made them more than 2 years ago. So just I started as a natural way, okay, normal, okay. Because I have made these samples, I will never forget, okay, how I will trick you, okay. Do you think I will give you the same word birth defects in the text?
No, sir. Maybe you
Do you
can
think
use a synonym of this word like birth anomalies or any birth.
congenital? So I will use some, some synonyms, okay? Some synonyms, some relevant words, some related words, okay? So what is possible instead of birth defects?
So
Abnormalities.
abnormalities.
Congenital abnormalities, okay? What else? Maybe I am giving the name of any exact birth defect, okay?
Yeah, that could be.
Okay.
Yes, sir.
Maybe I'm just saying issues at birth. Okay.
Yeah.
Okay. So now you need to think in which text it is possible. It is possible in text A, where they're talking about how acid is produced, how omeprazole acts, and the role of omeprazole in pharmacy you can get from pharmacy or not. Do you think is this in text A or not?
No.
Yes, sir.
Yes, sir.
No, sir. Okay, very good, very good. You are intelligent. Okay. The only problem with you is when you go to the exam, you cannot manage your time. Okay.
Yeah.
Okay. So now reading in text B. It is possible in text B where we have algorithm,
No,
No.
No, sir.
no, sir.
because they're just talking when you use this treatment, what you will do, which test you will do. If this treatment is not good, then what you will next do. Okay. This is just like, okay, treatment algorithm. Okay, then you have two texts. One is cautions and one is text D. So in text D you have two types: long-term use and pregnancy and breastfeeding. Okay, do you think without reading is it possible in cautions or in the text
Sir,
D, in
C.
C or D?
Sir, C.
Text D.
C.
D.
It could be in C or D,
Pregnant.
D, sir.
how? So
C,
it could
sir.
be in C or D, but what comes in your mind first, C or D?
D.
E.
D. Okay.
Because it's related to pregnancy, sir.
Yeah, but pregnancy, breastfeeding, these things. Okay, first first text D will come in your mind. Okay, so here you have to do is you need to see in pregnancy and breastfeeding birth defects. Okay, quickly. Pregnant breastfeeding woman, risk of birth defects. Okay, does not show any
Major birth
increased risk of birth
defects.
defects after maternal use of omeprazole during pregnancy. Okay, no clinical trials of this. Okay, so I think I got the answer. Okay, so no role of
Yes, sir.
omeprazole in birth defects. Okay,
Yes, sir.
can you find the answer in D or not?
Yeah, of course.
Oh,
We are
D,
fine.
sir.
Yes, sir.
Yeah, the answer is in D. So if you have done skimming and scanning, okay, then you can easily find the answer. Okay, you can easily find the answer. Okay, okay. So now let us see and see also if there is any word like birth defects. Okay, and methotrexate there is nothing about birth defects, gastric malignancy, nephritis, no clopidogrel, no. Here they are talking about magnesium deficiency, no, nothing is
Not
here,
mentioned, sir.
no, nothing related birth defects, no. Okay,
Yeah.
so in reading part A, you will get some easy questions. There are three types of questions that we include in reading part A. Number one, easy questions, moderate question, and difficult question. You will see almost 10 questions reading part A, that would be easy, okay? 10 questions. 5 questions would be just middle ones, okay? Some of you can do, some of you will find it a little bit difficult. And 5 questions almost will be a little bit challenging. And you will spend a lot of time to find their answers. That is your main, okay, exam, okay? Okay, so next question, who will answer? You will tell me how you will find it, because this is not just giving the answer. Anyone?
Text B, sir. B.
No. You will not have just one person who will answer the question. Miss
Yeah,
Nirmala?
text B, sir.
Yes, sir. B,
Mohammed,
sir.
yeah. Okay. So let us take Miss Nirmala, okay? Okay, Miss Nirmala, what are your keywords here? Steps to follow when reflex symptoms do not respond to conventional treatment. What are your keywords?
Symptoms, sir.
Reflex symptoms, conventional treatment, okay? Yeah.
And stage.
Yes. Okay. So, okay. So do you think I will give you the same word conventional treatment in the text?
B, sir, B.
Text B, sir.
No. My question, you don't try to, be quick and hurry, okay? Do you think I will give you the word conventional treatment in the text?
No.
No,
No.
sir.
What you can see in the text instead of conventional treatment? What you can see?
So share the screen of passages. Text.
Normal treatment, classical treatment, okay? Basic treatment, any of these things could be, okay? Conventional treatment, routine treatment, classical treatment, okay? Normal treatment, any of these things. What I can use instead of do not respond? Medically, what kind of words you can use instead of do not respond?
Not
Is
resistant,
it
sir.
something resistant? I can use word resistant, okay? If any disease is resistant to this medication, I will use other medication, okay? So now, in which text it is possible to find the answer? In which text? In which text is possible to find the answer? Text B.
B.
So you can see one word also, steps. Steps is mostly, the things that will go step by step, okay? In order. So I think in text B, you can find something in according to algorithm, okay? So who thinks that the answer is in text B? Any of you? Any of you? Okay. So let us know we need to find the exact words there, okay? Can you see refractory GERD? Can you see the word refractory GERD, treatment of refractory GERD?
Yes, sir. Heading line. Diagnosis and treatment of refractory.
Your answer is in the heading line. Okay. What does refractory mean? What synonym I have used instead of refractory in the
Do not
in the
respond.
question? It is not responding. So I will not give you word refractory. If I give you word refractory in the questions, then there is no purpose to take the exam. I am not, testing your English language. So how I can test your English language? This is not medical exam. This is English exam, okay? So instead of refractory, I am saying something not responding to treatment, okay? So here is review PPI time and compliance. Here is endoscopy treatment mucosal finding. So this is empirical therapy, classical treatment. You can even say like this. Okay. So this is how you will find the answer. Okay. Now let us go to the next question. Okay. So why amyloid is secreted in breast milk? Why? Who will answer this question? Who will answer this question?
D, sir.
So who will answer question? Doctor, who has answered this question?
That was just because of a protein binding, something like that was mentioned in
Yes, doctor. Yes, but someone else has given the answer, please. Can talk with me again? Who was there? Who was there, please? Okay. Okay. So where it is possible to find the answer, you can write in the chat, okay? Where it is possible to find the answer? In which text? What are your keywords here?
Breast milk, sir.
Huh?
Breast milk.
Breast milk.
Breast milk, okay. Can you see the word why it is secreted in breast milk? Okay. So there are two things, breast milk secretion and reason. Where you can find the answer in which text?
D.
D.
In text, which text?
D.
D, sir.
Just write in the chat because I cannot understand. Is B or D or what? Okay. Someone saying CD. Okay. Anyone else? Write in the chat, please. Okay. D, D, D. Okay. Okay. So let us go to D and let us try to find the answer. Okay. Why it is created in breast milk? Okay. Do you think it should be in long-term use or it should be in pregnancy and breastfeeding? It
pregnancy
should
and
be in the
breastfeeding.
second part. Okay. Now try to find the exact answer. Tell me in which line you can find the answer. Okay.
Breast
Point number one.
No, please, in the chat only. Only in the chat. Okay. Only in the chat because other people are also thinking. Please mute. Don't disturb others.
Point one, bullet number one.
Bullet number one. A little amount of drug is transferred to the milk during breast milk formation. Okay. Breast milk formation. What synonym is there?
secretion.
Okay. Yes, secretion. Secretion. There is also possible to find the answer in text A. Let us try in text A also. Okay.
Not mentioned here, sir.
No. ये ना है hepatitis B.
Yes, please.
Hepatitis
Yes,
B
please.
काली साई को ना hepatitis A.
Okay, so answer is not in A. The answer is in text D. Okay. Very good. Okay. Just I'm checking text C. No, so your answer is in text D. Okay, very good. Excellent. So next question. Who will answer next question? So how omeprazole helps in relieving symptoms of reflux? How? Just quickly, please. Who will answer this question? If which text is possible, just write in the chat, please. Those people who are on Facebook, you can also write in the chat, okay? Where you can find the answer.
Just see.
So where you can find the answer? In which text? So in text A, you have physiology. In text B, you have algorithm over treatment. In text C, you have cautions. In text D, you have long-term use and breastfeeding and pregnancy. Okay, so in which text is possible? Write in the chat, please. Just quickly, please, where you can find the answer. In B and C and D and A, where you can find the answer. Just quickly, please. So some of you are saying it could be in C and A. So anyone can talk with me where it is possible to find the answer in which text?
A, sir.
Possible in text A, sir.
Text A. Okay. Why it comes in your mind that the answer could be in text A? Why?
Because all about omeprazole.
Yes,
it
the omeprazole, but what comes in your mind?
Relieving symptoms of reflux, talking about A.
Because they're talking about in text A about physiology, about you know
Yes.
how the medication works. Okay, what is the physiology of GERD? What acid is produced? Then how antacids help the okay to alleviate these symptoms. Okay. Now try to find the exact answer. This is the text. In which paragraph you can find the answer? This is the This is the
Reduce the symptoms of acid reflux disease.
So second
this will
paragraph.
be the
third line.
paragraph. Just write in the chat. Paragraph and line, please.
Second paragraph and last line. Second
Last
last line.
line. Second last. Okay. So by decreasing the amount of acid, they also help to reduce the symptoms and reflux. Okay, very good. So how it helps in relieving symptoms? By reducing the amount of acid. So they help to prevent ulcers from forming and assess the healing process where damage has already occurred. Okay, so the answer even starts here. Okay, such a micro stops cells in the line of chromosome from producing too much acid, and by decreasing acid, they help to reduce the symptoms of acid reflux. So this is how they help. Okay, this is overall the process. Yes or not?
Yes, sir.
Yes,
Okay,
sir.
very good, very good. Okay, next question. Next question. If any of you has anything important to do, you can leave because this is not obligatory class. Okay. Question number 5. A mention of the reason for increased tendency of fractures in patients taking PPI. Just write in the chat where you can find the answer. Just in the chat, please, quickly in the chat where you can find the answer. Just quickly, please, where you can find the answer. In which text you can find the answer. Why it comes in your mind that the answer could be in the C?
Because all about long-term use of omeprazole.
Where is written long-term use?
Long-term use is talking about D, but text is talking about the portions.
But they
Talking
keep
about the fracture and osteoporosis.
Yes.
Talking about
Yes, they were talking about calcium, osteoporosis, and these things, okay? Why you are able to answer this question without even going back to the text? Why? Why?
I remember, sir. I properly
Because
scanning
you
and
have done very good skimming and scanning. We have done very good skimming and scanning because we are taking the class for almost for 1 hour and we're discussing these things. Because in the real exam, you will get only 15 minutes for all of these things, okay? So, by quick skimming and scanning, quick and careful, okay? Because you have to also keep in mind the important things. Otherwise, you will just, waste your 1 and 2 minutes at the start, okay? So mention of reason for increased tendency of fractures in patients taking PPI. I am not using long-term use because if I take long-term use is in the second in text D, okay?
yes, sir. That's the first line.
In which bullet point? In which bullet point? So number 1 is Clostridium tendinous diarrhea, liver here, lupus here, and confirmed. So here is prolonged use result in muscle spasm, seizures, magnesium sulfate, magnesium propounds discontinued, clopidogrel. Taking antinephritis relief symptoms, malignancy, methotrexate, when instrument together, related to toxicity. PPI. Very good. Can you find anything related to fractures and these things in text C?
No, sir, that's what I'm saying. This is in text D.
This is how you will get. The answer was very easy in questions in text C. Even I myself, believe me, I was thinking it should be in C.
I
But
said it was in B, sir.
but
D.
whenever the answer comes in your mind, you need to verify it. Go back to the text. Go back to the text. Verify it. Okay. Let's go to text. Believe me, if you get this in the real exam, 50% of you will write here text C. 50% of you. Can you see something with these keywords in text C? Your question is here. The reason of increased tendency of fractures in patients taking PPI. No, this is diarrhea, this is liver disease, this is lupus. They're not talking about fractures. This is carcinoid tumor, this is magnesium deficiency. They're not talking about anything about fractures. This is spasm, heartbeat, and seizure. Then we have PPI, clopidogrel. They're not talking about anything about fractures. They're nephritis, no fractures. Malignancy, no fracture. Methotrexate, leading to toxicity. Temporary withdrawal. So they're not talking about anything about fractures, increased tendency of fractures in text C, okay? Now let's go to text D because we cannot find the answer in text C. We have to go anywhere else. So can you find something in text D?
Is text causing increasing risk
Which
of
paragraph?
Long-term use of
Which paragraph? Which paragraph?
Second paragraph, second line.
second paragraph.
Second paragraph, okay.
Second
Where?
line.
Which line?
Second line.
Believe me, if I give you, this is the question. Let me,
Use of PPA associated with decreased calcium
believe
absorption.
me, if I give you the word here, a mention reason for increased tendency fractures in patients taking long-term PPI, a PPI for long time. All of you will get text D, yes or no? If I give you something, synonym of long term, okay? Yes or no? all of you will go to text D. But I have not here mentioned any duration. So most of us, including me, first we were thinking about text C. I will not answer C in the real exam before verifying it in text C, whether it is there or not. You go back to text C, verify if the answer is there. You match the synonyms, the keywords. If it is there, write text C. Otherwise, go to other text to find the answer. Okay. This was interesting or not? This question. Write in the chat. Was interesting or not? So who has written C? Most of you have given the answer C. Okay. Okay. Anyone who was sure that the answer is not in C is in D? Anyone will get one free letter correction. Okay, so you can text me at the end of the class on my WhatsApp. I will mark your one letter for free. Okay. Okay. So next question. This is an interesting question, by the way. It's not difficult. If you go here, you can easily find the answer. Any one of you can find the answer. This is the main thing is time management. This is the game of time. Reading part A is just game of time. Okay, okay now. No, the question number 6. Why patients feel symptoms of heartburn? Why? Why they feel symptoms of heartburn? Where you can find the answer?
It's in A.
In which text? Write in the chat, please. In which text you can find the answer? In C? In
Yes, sir.
A? In C or in A? In C or A? Okay. And where it is why patient feels symptoms of heartburn? It should be, in my opinion, in A, because they're talking about physiology. Okay, pathophysiology, physiology. Okay, in text. In C, they're talking about cautions. Most probably is in A. Okay, you will come to text A. The question is why people feel symptoms of heartburn? Because acid is produced naturally in the stomach. It digests food in bacteria. Acid is irritant. Body produces natural mucous barrier to protect the lining. In some people, this barrier can break down during allowing the acid to damage stomach, causing inflammation, ulcers, and other conditions. We can have problem with muscular band. So this
It's
is
in
also referred as acid reflux. So this is just definition of acid reflux. So your answer is in text A. Okay. In text A. Yeah. The first paragraph. Yeah.
No, sir. Second paragraph, last line.
And second paragraph. Yeah. Where?
last lines.
Last line.
Third paragraph.
This one?
No,
Third
third.
paragraph.
Third.
This one?
Yes.
Yes.
You can buy short course of omeprazole at the pharmacy for the treatment of reflux symptoms such as heartburn and not. No, this is not the answer.
Sir, first paragraph, last sentence. This may allow the
Yeah.
insect to escape and irritate the
Overall,
esophagus, causing heartburn.
overall, your answer is incomplete this paragraph.
Oh,
Okay. Overall, incomplete this. You will just answer text A, but your answer is incomplete paragraph because they're talking about the whole physiology. How? Let me see the question again. Why patients feel symptoms of heartburn? Why they feel? Because first of all, we have some protections. So this is irritant. We have mucus. We have mucus barrier. Okay, when there is inflammation, damage to stomach, other conditions, and when there is a problem with muscular band at the top of stomach, and they then this may allow the acid to escape and irritate the esophagus and causing heartburn. Okay,
this one is the answer.
the last line. Okay, last line, heartburn. Refer to acid reflux. Yeah. Good. So now question number 7. If you have not done this schematic scanning, even you are not able to answer quickly the answer question number 7. Where you can find the answer to question number 7?
Please, sir.
Where? Where you can find the answer to question number 7?
Text me.
That was in the article was mentioned over there.
In text A, it is not possible, okay? Because
Yeah,
they're
we
talking
talking
about physiology. And
about
B is not
vegetarian.
possible, so, okay? And C, they are talking about cautions. Where it is possible, but it's
D.
most likely in D, okay? Yes or not?
Yes, sir.
Okay. Do you think I will give you the same word a study in the text?
No, sir. No, sir. It may be trial.
Maybe, but I will try to give some synonym, okay? Okay, can you find the answer in text D? Just write in the chat. Don't tell me, please. Just write in the chat. In the chat, please, only. In the chat. People on Facebook, you are not active. You are not too active. People on Facebook. If you okay, no, you're giving likes and these things, but you should also comment. So if you're not going to comment, so we are going to end the class. So if you become active, maybe I will continue. Okay. So I am waiting. If you people on Facebook, if you also comment, you write something in the chat. Okay, then we will continue. Otherwise, I will see that you are tired and I'm also tired. We will go online. We will go offline. Maybe I continue teaching those who are with me on Zoom. Okay. Okay. So where is the answer, please? People on Zoom, where is the answer? In text D. Text D, okay, in text D. But where is the answer? In which paragraph, which word? What are the synonyms that I have used? In the chat, please, okay? In the chat. Yeah, it is in text D. Your answer is in text D, but where is the answer? Which line, which paragraph, and which synonym I have used? Just I want to teach you because we cannot spend daily 1 hour to teach you all these things. Just I'm giving you overall how you will do the reading, okay, in the real exam, because we cannot do a complete paper even in a complete reading part A, B, and C even in 5 days if I keep teaching like this. So this is just to give you overall how to do and how to attempt. Okay, so this is your question and your answer is in D, but which synonym, which things I have used? Can you see
Five.
some anywhere
Five.
study? The word study, can you see?
So review article.
Review article. Even there is name of the, maybe what you say, magazine or something where they have, published this article. Okay. So US pharmacist, this is, you can see the name is the capital. The name is in capital, mean this is name of any website or any organization, okay, or any magazine. So they have published or they have done the study. So they may be published, okay. They have published one review article, and this article states that if there is long use of PPI, it can decrease calcium absorption, causing electrolyte disturbance, and it can lead to a infection, osteoporosis, and these things, okay, fractures and these things, okay. Okay, now should we move to next? Should we do more questions or we should do tomorrow? Okay. If you don't leave, then I will do. Otherwise, if there is only 1, 2, 3%, then I cannot. Should we do more questions? People on Facebook? People on Zoom also, you can answer. Should we do more questions? Should we do more questions? Yes or no? So let us try just to fill in the blank question, just two, then we will leave, okay? By the way, we have a VIP hybrid writing course. VIP writing course in which you have, I will mark 14 letters for you, and mostly I keep helping my students till their exam, and we have also speaking feedback, individual feedback, speaking feedback, just one-to-one class, one-to-one feedback with me, and also writing feedback from me, okay? Only from me, okay? We don't have any other teacher, okay? I cannot trust anyone else, okay? Let us do this question. Let us do this question. Okay. First, you will tell me where you can find the answer, in which text. Then we will find the exact text, because this is fill in the blank, not just text A or B, okay? The question is, what we should do if you are unable to perform a specific test and there is partial relief of symptoms after taking PPI every 12 hours? In which text is possible to find the answer, please, quickly?
Text A.
People on Facebook, where you can find the answer?
Text A.
Text B, sir.
B, sir.
Okay, here you have complete question. You have complete question. You have algorithm. You have to fill this blank, okay? Fill in the blank, okay? Write the answer in the chat, please. You don't need to tell me. Those people who are on Facebook, you can also try this. If you are unable to see it on your mobile,
Switch
on
to
your cell,
another PPA.
then you can just change. You can change to horizontal view. Then you will be able to see, because I have to show you the complete text, okay? You can change into horizontal landscape, okay? Okay, so write in the chat what is the answer, because this is the fill in the blank. Okay? I will give you 2 minutes. Quickly, please. Please write your answer in the chat on Facebook or on Zoom so that okay, I can see the answers in on WhatsApp. Oh, sorry, on Zoom. Empirical therapy. Okay. Miss Bushra, can you talk with me?
Yes, sir.
Okay, so why your answer is empirical therapy, please?
Because, sir, it's
You will
written
give me,
here.
yeah, how you were able to find the answer? You will tell me.
Sir, it's written here. Actually, it is directing us with the help of arrow. And here it says PPI daily AM or PM for 2 months. And the left side, it says esophageal impedance plus pH.
Impedance, yes.
On the
Yeah,
left side, it says failure, no access
yeah.
to esophageal. I cannot see
Impedance.
the next one. And it
Yeah,
says empirical
impedance.
therapy.
Okay.
Yeah. And it says empirical
Yeah.
therapy.
Okay, what are your
So,
keywords? What are your keywords?
Specific test is keyword.
Failure.
Number one is
Failure.
you're unable to perform a specific test. This is one keyword, okay? Other keyword is after taking PPI every 12 hours. So would you find the exact word every 12 hours?
No,
No.
sir.
You will find in the exam here, it is once daily means every 24 hours. So your answer is not here. I will just quickly start from here, okay? So, no. Here is twice daily. It could be every 12 hours. Okay, no. You are close to the answer. Find the other keyword when you're unable to perform a specific test. Okay. So twice daily for 2 months. Okay. So if there is failure, we have two options: esophageal impedance plus pH is empirical therapy. Even if you don't know what is esophageal impedance, but you can see this no access to esophageal impedance and unable to perform a specific test.
Same thing.
This is a test, and you have no access. You are unable to perform. You no access, unable to perform. Okay. So your answer is not esophageal impedance or pH or something from here. Your answer is here, empirical therapy. This is a tricky question, by the way, tricky question, okay?
Really, sir, it was so tricky.
Yeah. Okay, only one more question. Okay, last question. Okay. So, if we are aiming to relieve heartburn for a short period of time, omeprazole can be found at you will not answer me. You just answer in the chat. Okay, in which text it is possible to find the answer? In which text? In which text is possible to find the answer? Just quickly, please. Just quickly, please. Okay, very good. You will get easy question also in the real exam if you have done good skimming and scanning. Okay. So here is your text A, and here is your question. Please just fill in the blank because this is not just text, is fill in the blank. So fill in the blank. What is your answer? Fill in the blank, please. Fill in the blank. Fill in the blank because this question is fill in the blank, not only in which text you can find the answer. What is your answer, please, quickly? Match the keywords. What are your keywords here? Can anybody tell me?
Relive hard one
Heartburn.
and first aid.
So your all the keywords can match here in the last paragraph here, okay? For short period of time, if you want relieve symptoms, okay? Treatment of reflex symptoms, you are want short relief, okay? You can see I'm using synonyms. Relieve heartburn means even I'm not using reflux symptoms, I'm using heartburn, okay? Relieve treatment, though I'm using relieve, okay? If you want to buy, I'm using if you are aiming, okay? So I'm using synonyms, okay? What can be found at this article means there should be a noun, okay? At so what should be the answer?
Pharmacy.
At a pharmacy. Very good. Very good. Very good. Yes, the answer is pharmacy. So I hope I will continue taking free classes. I hope so, because as you know, I get busy also because I am working doctor. So if anyone wants to join, I will also continue writing and speaking classes. So if anyone wants to join my writing feedback and speaking feedback, these are individual classes, means in small group, and speaking feedback is individual, means one to one. And we have good results. Some of you are already my students and some are new. Please, for next free class, invite your friends, okay, who are taking OET exam. Invite your friends and try to join in next free class. And if anyone wants paid classes, we have writing and speaking feedback class available. Thank you so much. If you are not in my WhatsApp group, so try to join WhatsApp group so that you can get any notification for free classes quickly. Okay. Thank you so much, all of you. Any question? Anyone wants to ask anything? Any question? Any question?
No, sir.
question?
Thank you so much. Thank
Thank
you.
you so much, all of you. Thank you.
Yeah,